For those who are tuning in, we're going to start in just a minute. We're just letting people kind of gather before we get started, but we will get started in just about 60 seconds. I think we're going to get started. I hope we have some people. Actually, we have quite a few people on, so that's good. For everybody joining us, I'm going to bring Susan up here in a second. And just there, Susan. So for those that haven't met us before, I'm Robin from the Dog Gurus, and Susan's over there in turquoise. And we are going to spend some time talking about business disruptions based on coronavirus. And I know we have been getting a lot of emails from our members saying they're getting cancellations and what should they do. And we also are going to be bringing on David Pearsall in a minute to talk about insurance implications as well. So we'll kind of monitor the questions as we go along. If you have questions, throw them out to us and we'll answer as many as possible. But I want to get started just before we bring David on, just to basically talk about what is coronavirus or COVID-19 or COVID-19, depending on who you're talking to. Most of you probably know it's a respiratory illness that started in Japan or in China, and it's been spreading obviously throughout the world. It's really just spread by droplets. So basically like a cold, you cough, you sneeze, and droplets get spread, and then people pick it up and then they are infected as well. So very similar to how a cold or a flu spreads. They also assume, and this is they, meaning the CDC, the Centers for Disease Control, also say that it possibly can be spread if somebody coughs on something and you touch that and then touch your face or your nose, and you can get infected that way as well. Susan, you want to talk a little bit about the symptoms?
Sure. The symptoms for those who actually are symptomatic with the virus is a fever, cough, shortness of breath. So it can resemble the flu, but I think what's most important to keep in mind is you can carry the virus and not show any symptoms at all. And I think that's what's making it really hard to control. But I think educating your employees about the symptoms is going to be important, and yourself. And go to the places with the facts. Don't rely, this is not a time to rely on social media posts about symptoms or spread.
And then also the information just in terms of how to protect yourself. And this, again, is coming from the Centers for Disease Control. Protecting yourself, again, similar to how you would stay safe from the flu, and that is to avoid contact with people who are sick, obviously. Avoid touching your nose or your eyes and mouth. I actually started noticing how often I touch my nose and my eyes and my mouth and my face in general. Once I was told, no, I shouldn't be doing that, I'm kind of surprised at how often I actually do that. And then also washing your hands a lot, which obviously if you've been watching anything on social media, you've seen all the people joking about, suddenly now we're washing our hands, but washing your hands, and there's a specific way to wash your hands. So you should be washing your hands at least 20 seconds and then using hand sanitizer. And it's important to note that hand sanitizers are not all created equal. So the hand sanitizers should have at least 60% alcohol. So check that as well. So those are some very basics, which probably many of you knew, but you want to start educating your staff so they know that stuff as well. And again, the best resource for that right now is really the Centers for Disease Control. They've got whole fact sheets out on all of this that you can pass around. We're going to jump into kind of what to expect for your business. And I want to bring up David Pearsall. So David Pearsall is from Business Insurers of the Carolinas. He's kind of our insurance guru. He's our go-to guy for all the insurance stuff. And let's see, I can't see you, David. Can you hear us, David? Where did David go?
I know we tested this and it worked perfect. But it is great to see all of you guys out there. We know a lot of you that are on. We appreciate you jumping on. And as Robin said, you can post questions and we'll answer them, or David will answer them, because I see David now.
Yep, there he is. Can you hear us, David?
I can hear you now.
Okay, David's there. We're in 3 different locations, so it's always interesting to see how. Yep, we can hear you. I can hear you. Can you hear us?
Great. Yes.
So David, I'm just going to open it up to let you kind of talk a little bit about some of the insurance implications. And Susan, I think we have some specific questions we were going to go over with him.
Yeah, I think the big question that people want to know is, will insurance cover business losses from reduced revenue based on cancellations or lack of reservations for coronavirus? And I know everybody's policy is different, but I guess talk in general about the insurance.
Great question, and it's one I've been certainly. That's a great question. I've been fielding it for about the last 2 to 3 weeks now, sometimes hourly. Unfortunately, there is not a lot of coverage. Really, there's no coverage under a business income. The reason being is it has to be a direct, meaning that there has to be a physical loss, say, your facility, or to, that it's going to create a business income scenario with most all, and so policies that are out there covering type of business that virus or bacteria exclusion look at. There's another wording in some of the coverage forms. Don't leave your house. That could also be in the wording of the policy. Just to review, but again, and most of the time you're going to see a virus or bacteria exclusion. So if there's still not going to be any paid loss.
So I think, David, you're kind of going in and out right now. I think, can you hear us still?
You got people can't gonna hurt us as
Yeah, Robin, do we want to do some?
Y'all been coming in and out too a little bit.
Yeah, I think, see if you can, you might have to switch. Well, see if you take I'm going to turn the video off and see if that helps with the bandwidth, because I think it's a bandwidth issue on your end. Can you still hear us now if I do that, David? Maybe not. You may have to try checking it. You may have to try coming back on your computer or on your iPhone to see if it's better bandwidth. Yeah, we're getting people saying it's hard to hear because you're kind of coming in and out. Or if there's any other things running on your computer, you may have to shut those down too.
Sure.
Okay. But while we're having David do that, we will cover some other questions and then just come back to him. So don't lose your insurance question. So one of the things I was going to mention briefly was there was a study done about whether or not you can get coronavirus from pets. And there was one study done saying a dog in China has tested positive. And that's there's a whole article out there about the fact that that isn't really the same coronavirus. And it's not, CDC does not think at this point that you can catch it from a dog, that it doesn't transfer. It's transferring people to people, not people to animals or vice versa. But they do say, the CDC does say that if you have a pet and you are infected, it is possible that you could sneeze or cough on your pet and they could get those droplets and then carry those droplets to another member of your family who might, hug or kiss your dog too. So there is actually on the CDC website a thing saying that you should restrict contact with animals. And that's a big concern obviously for us in the pet industry, because it might mean that people are not going to bring their dog to interact with other dogs. So definitely be aware of that. And if you have your clients asking about that, we're going to talk about some ways that you can help to calm some of their fears. So I would definitely be aware that that is out there on the CDC website though. Susan, do you want to, let me just check. I think he's still working on getting back in. So if you want to start, Susan, a little bit with talking about what business owners should be doing with their employees.
Okay, yeah. I think having a meeting and talking about some of the information from the website about how it spreads, definitely to not come into work if they are feeling sick. But to, I would really focus on prevention. Stay home when they're sick. If they cough or sneeze, cover your mouth with a tissue and then throw that tissue away. And then clean and disinfect touch objects and surfaces. And so really explaining that they're using the right solutions and cleaning protocols. I would refresh on all of those, especially the difference between, disinfecting versus cleaning. And just doing extra cleaning right now is really important. And, at this point in time, you probably don't want to be sharing things without wiping them down or, even shaking hands. It's the time to be safe. Having extra stations for hand washing or sanitizing. I would do this in various locations throughout your center. To make it easy and that they do it at the right times for the employees. But I would also have a station in my lobby for clients to also feel, and that they even see that you guys are washing hands between contact with different pets and clients. It will put them more at ease. And definitely, if they're feeling like they have any symptoms that they need to stay home, I know probably most of us do that anyway, but for employees and a lot of our staff need the hours and the paychecks, so there is a tendency to come in even if they're sick. So if you don't have a sick leave policy, you might want to put one in place temporarily so that they get some pay and do stay home and don't spread the illness in the business.
Yeah, and then other things is making sure you really are improving your cleaning protocols. Hopefully for pet care facilities, this is sort of like when we talked to the Omni Hotel for our summit, and they said, our normal cleaning protocols require us to do certain things. And that's pretty much how a pet business, a well-run pet industry or business company is going to be. You probably have really good cleaning protocols already, but this is a really good time to go through those again and make sure you really are combating every possible exposure. Maybe some things that you used to only clean daily might need much more frequent cleaning. So as Susan said, it might be after every dog interacts with something or every person. So really, really taking a look at those cleaning protocols and adjusting them for this outbreak. Knowing the employee travel plans, making sure you know where your employees are going if they are leaving the area or going out of the country especially, and making sure if they've been near any kind of exposure that they tell you about it and you're aware of it. So talking to your employees about that's going to be really important as well. And then if you have the ability to limit your all hands meetings, I know we want to pass all this information along, but this might not be the best time to be like, okay, all 50 employees come in and we're going to have a meeting. So if you can do those meetings through teleconferences as much as possible or video calls or something like that, that may be a little bit better, especially if you have multiple shifts, because we are going to talk a little bit about what happens if an employee does get exposed, but you also want to limit that spreading through your own facility. So some of those all hands meetings, if you have a large facility, maybe do those through teleconference. All right, I'm going to jump back. So Ray Bauman said it's nearly impossible to buy hand sanitizer now. That is true. So there are some recipes out there for how to make them, but you really have to make sure that you're following a good recipe, and it does have to be 60% alcohol content. Otherwise, there have been some places I've seen online where you can order some hand sanitizer as well. So might cost you a little bit more, but that is an issue. And then Dee Dee actually said rescue to the rescue. And ironically, Virox, who sells the Rescue, which is a brand name cleaning agent for pet care facilities, they were actually one of our sponsors for our summit. And they were going to before this even happened, they were already going to be putting in sanitation wipes in the swag bags. And they emailed me and said, we can't prove it because it takes a year to go through FDA, but we're pretty sure that Rescue is going to kill the virus. So I just thought that was sort of interesting, but you might be able to get some wipes that way as well. That would be able to. So that's another great thing. All right. So I think David's back. So we're going to try. Are you there, David? Let me try showing you.
Hey, can you hear me?
Can you hear it? I can hear you. Your screen looks clear, so hopefully that will work. Now I hear myself twice. Hang on a second. I'm going to get rid of one of these, David. All right. I got rid of one of you. Is that good? Are you still on?
Yeah. Yes.
All right. All right. So David is back. So for those that joined us before he left, David Pearsall is from Business Insurers of the Carolinas. He is our insurance guru. So we go to him for all our insurance questions. And obviously everyone might have different insurance policies. So we're just going to ask David to help us with some generalities in terms of your business and this virus. So I'm just going to have you start over, David. And Susan had asked about what covers, if anything, business losses. Like, is there any kind of insurance that would cover if you had to suffer some kind of business loss because of this virus?
Yes, unfortunately, that there's not a whole lot of coverage there, and it's a great question, and I'm getting it quite a bit, as you can imagine, since this outbreak started. And what's happened is, everybody wants to have coverage on their business income because they anticipate a loss of earnings over the next weeks and months that are ahead. Problem is, if you don't have a direct hit to your facility, such as a fire or a wind damage or weight of snow and ice, some kind of physical damage to your facility, business income is not going to be activated. And unfortunately, something like a virus is going to be excluded under 99% of the policies, either a virus or bacteria exclusion. Now, not to say that there may not be a special form under one policy that somebody may have. So I would advise you to check with your agent. But across the board, I work with a lot of insurance companies, from CNA to Travelers to Hartford to Hanover and all of these different companies. But most of the time, under a business owner's policy, which most of our clients and most of our competitors are using, are going to have that virus or bacteria exclusion. Then they will also have some language about civil authority. So if the government says don't go out and go to your restaurants, don't go out into the public, those are things that will come into play if that happens. And typically the civil authority exclusion will say if there's not direct physical damage to your location, then there's no coverage for business income. So, and this is just so I can let you know, we work with all kinds of clients, from restaurants to convenience stores to you name it. And we insure all those in our business. And every single one of us are feeling this. And we're fielding questions from everyone.
Yeah, and that's not the news everybody wanted to hear, sure. But obviously it's reality.
Yeah.
So what about if an employee gets sick with this and has to, they're saying and we'll talk more about employees in a minute, but if somebody gets infected, they're saying you should be self-quarantined at home, so you can't come to work for 14 days. So what happens if one of your employees gets sick and then they're staying at home? is that something you can claim for workman's comp, or is then there any loss of coverage because that employee can't work?
That's a great question. It's the second largest question I'm getting right now is workers' comp. And in fact, yesterday I had a dog trainer who has a job training someone's dog that is in quarantine at the moment. And she was asking what if she contracted the virus. And the short answer is no, workers' comp is not going to cover that because it's not considered an occupational disease. Under a workers' comp policy, they're going to cover injuries that happen on the job, such as a dog bite, slip and fall. And they also cover occupational diseases, such as carpal tunnel, if you're a coal miner, black lung disease. In this instance, this is a virus similar to the flu. And even if you have to fly, let's say I send one of my employees out to fly to a conference down to the Dog Gurus, and they contract it, they could easily contract that in their personal life, just going outside. And so there's no real, the only way this would probably be covered and could possibly be covered in the workers' comp is if you were a healthcare worker and you were sent to the hospital where you were working with the people who were constantly infected. So then they're exposed to that 99% of the time during your job. In the pet care industry, that's not necessarily the case. Now, you could have a random person come to the workplace and infect you. You could certainly try to turn the claim in, but in all likelihood, it's not going to be considered an occupational in our industry, in the pet industry.
Okay. So let's say I did want to just try to to file it.
Yep.
Because I really want to do something. What would I need to file a claim like that for whether it's for business loss of income or I have to shut down? Like if I was just going to file a claim, what are the things I would need to justify all of that or put together for the insurance company?
Sure. So basically, it's going to be different under every policy you have. So if you have workers' comp, you're going to need to know what happened that caused the injury or caused the occupational disease. You're going to need to give them the contact names of both the employee and any witnesses that observed the act or the injury take place. You're also going to need to let them know, where it happened, when it happened. And you'll obviously need to know your policy number, and you always want to call workers' comp claims and all claims directly in. Used to be they would say call your agent. Well, now they want you to call the company, so you're speaking to a loss control or a adjuster from the very beginning. So that way there's no loss of information. So even if you call us and say, I think I've got a claim, we're going to hand you the number for the company and say call directly, because they don't want any information lost in between. And it's not that I don't want to take the claim. We certainly would be happy to, but the insurance companies want us to have it come directly from the person. And with workers' comp, they're gonna take the employee's statement just like they're going to take the employer's statement. So
Right.
they're going to, once you give them all that information, contact information, name, and what happened, they're going to call your employee. They'll call the witness, and they'll do their investigation and see if the claim is compensable, meaning can it be covered under the current policy language. And once they determine that, then they'll make the decision, whether to deny the claim or to move forward with payment. And under most workers' comp, most states, all states have different workers' comp laws, but most of them say you have a 7-day waiting period before you receive loss of earnings. So, and then after 21 days, they'll go back and pay you for the first 7. So if I'm out due to an injury, the first 7 days, I'm pretty much on my own unless my employer wants to feel sorry for me and give me money for that 7 days. But then after 21 days, they will go back and pay that 7 if they're out that long. If they're not, yeah. So
Interesting. I actually did not know that. So that's good to know. And this is a question probably pertains to more than just this coronavirus, but we get asked this question all the time. So since you're on here, I'll take the opportunity to ask it. And people are always worried if their policy will get canceled if they file claims. And is that truth? Is that a myth? Is that somewhere in between?
Yeah, it's somewhere in between. And so let me give you a good explanation about how claims are handled. So typically most commercial insurers, meaning insurers of businesses, they're going to look at it differently than your homeowners or your auto. Personal policy, you could be paying, $500 or $1,000 every year for 20 years, and you have your home burned down. And the insurance company is going to say, well, I will never recoup that loss. And so they may or may not cancel you after one claim. But on a business policy, they're typically never going to cancel you on one claim. what they're going to look at is your performance over 3 to 5 years. And it's called your loss history or your loss ratio. And so what they look at is claims versus divided by the premiums paid in. So if you paid, let's say you paid $10,000 for 3 years, you paid in $30,000, and you have a $5,000 claim. Well, you're still very profitable to that insurance company. Now, let's say you have 5 claims for $5,000. Now you're getting closer to, their break evens for the insurance company. Insurance companies are just like you and I. Every business owner wants to make a profit. That's why they're in business. So that, they look at the relationship, how long you've been in business with them, insured with them. They look at, how much of the industry that they're covering, if that's a large portion. So, if I'm Travelers Insurance Company, one pet facility might not mean much to me. But if you're working with an agency or a company that specializes in the pet care industry, they may look, they're going to look at the types of losses that you're having, and they're going to look at gross negligence. So if you're told to muzzle a dog and you take the muzzle off, or you're told to use a certain type of leash or collar, and you fail to do that, that's gross negligence. So they're going to look at all those things on the types of claims you're having, and that's what will determine whether they'll cancel you or not, but usually not after one claim.
That's great. Yeah, definitely great to clarify that. So I know, David, you said that we really can't get business loss coverage for coronavirus, but since you're here, can you just talk about if they don't have that in their policy, why it might be a good idea, or what you recommend as far as, your clients and having a business loss aspect to their policy and what it would cover? Just kind of go through that again.
Yes, definitely. What I would say is that you always are going to want, if you have a facility, you're going to have property coverage. If you're buying property coverage, you're going to want to include business income and and extra expense. What business income and extra expense do is, let's say you had a fire at your facility, or you had a tornado or a hurricane come through. They're going to pay you based on the last 12 months of earnings. So this goes back to Robin's question, is, again, if it was a business income loss, you had to provide your financials so the insurance company can see what your earnings have been for the last 12 months. So each claim type is going to be different. But, so as far as business income being added to your policy, if you are a dog trainer working out of your home, or a pet sitter that's working out of your home, you're typically not going to need property insurance, and you typically will never have coverage for business income anyway, because if your home burns down, that's not going to be a covered cause of loss for a business. And the same thing for a dog trainer. So what the insurance companies look at is your ability to get up and go and work somewhere else if something like that happens. And as a contractor, most contractors can still go back to work, after an event happens like that. But if you lose your entire facility, you can't. And that's why you need the business income coverage.
All right, that's great information. And if you joined us late, this doesn't usually apply, unfortunately, to coronavirus. But again, part of this is learning when things come up, really what things do cover in our insurance. And if you don't have that, you may want to talk to your agent and get that. So, Robin, do we have any other insurance questions?
Nope, I think he covered all of them, the ones that came up.
Great. So, David, how can people get a hold of you if they would like maybe another perspective on their insurance coverage?
Well, sure. Thank you. They can either contact me directly via phone. It's 1-800-962-4611, and I'm at extension 214. Or they can email me at D as in David, P as in Paul, at business-insurers.com. And thank you for having me today. And any questions anyone has, please feel free to give me a call anytime.
All right. Thanks for joining us on this. We're going to keep talking about coronavirus, but thanks, David, for joining us. We'll let you go back to all your insurance phone calls.
Thank you, David.
Thanks. All right. All right. So we have still some more information. So we wanted to have David help to answer some of our questions right at the beginning, and then let him go back to his work. So we talked a little bit earlier. So if you just joined us and didn't see this, you can watch the replay afterwards. But we talked a little bit about, can you get coronavirus from dogs, and whether or not what you should be doing with your employees. And I did see somebody commented earlier that, regarding the dog issue, that she did have people who are pulling out of daycare because they're afraid that their dog will have the virus on their fur and then pass it on to somebody else. So that was Sarah Richardson. I have clients concerned about droplets on dogs being passed person to person and have already had people pull out of daycare for this. And again, that is on the CDC website that says that you should be limiting your exposure to dogs. So that's obviously a concern for our industry if people see that and decide they don't want to have their dogs there. So we want to talk a little bit about that. And then we talked a little bit about the fact that your employees, you really need to make sure that you're going over the protective measures we discussed and making sure they're washing their hands and keeping everything clean. So those are sort of the beginning stages. I think the next thing we want to really talk about are kind of those business contingencies. So I'll toss that back to you, Susan, to start that conversation.
Yeah. So, at this point, you really have to start thinking about what if you have an employee who's exposed and tests positive. And if it tests positive, your local community is going to be tracing that to see everywhere they've been. And so you will be probably in a situation to where if they had been at work, that everybody that was there that day would be put into self-quarantine. I don't know that for sure, but that's kind of what we've seen the trend, especially if it wasn't travel related. I know in Houston area yesterday was the first person that was tested that wasn't travel related, and that just set off a whole new protocol from the government on what's going to happen within the city. So it's good as a business owner and manager to think about, again, we talked about educate your team, but if the fact that someone does get sick, you need to plan what you could do because it could wipe out a big part of your workforce. And what's your contingency plan for that? So for your business, maybe you have smaller shifts and don't have people crossing over so that there's more of a distinct difference and not so many people that cross over, just to limit that exposure possibility. I think.
Yeah, Susan, that was actually Sabrina had asked that. Should we be rotating employees because we're all here every day? But I would think if you can keep the employees on the same shifts, that might help. If you do have an outbreak, you kind of know it's that shift.
Right, and it wouldn't be all your employees possibly. I mean, I saw in the thread, and we can relate about cancellations. It's a big reason we moved our summit, and I know for all of you that's an impact. So I guess what you may do is if you are having fewer dogs, it would be an opportunity, maybe short term, to create some different shifts. It's not ideal, but nothing's ideal in this situation. And it is so out of our control that we just need to think about it from a business perspective. So what may end up happening is everybody's hours gets reduced by 5 or something so that, it's kind of spread out. And that's not that some people don't work at all. And you really do need to think about budget-wise, what expenses will go down if you close. I know a lot of expenses won't. You'll still have, your rent and everything if you have to close for a short period of time. But thinking about that and knowing the budget impact for short and long-term scenarios is going to be really important.
The other thing, was it my turn now, Susan?
It is your turn.
The other thing I would be looking at is how you're going to communicate anything to your clients. So I'm a big proponent for writing letters early. So if you think you might have to tell your clients that you have an employee that was infected, or if you think you might have to close, just start drafting those letters now. Hopefully you'll never need to use them. But if you do need to use them, you're going to find yourself kind of in crisis mode, and then you're going to wish that you had that letter already drafted. So I would start writing any of those letters now. Don't wait. And then the other thing I would start looking at, and somebody had asked, because they came on and heard me talk about limiting exposure. So Karen said, wow, they're saying limiting exposure to dogs. And yes, on the CDC website, it will tell you to limit your exposure to dogs. They do not think that dogs can pass the virus to people except through droplets in their fur. So it's not that they're saying the dog can give it to you or that you could give it to your dog, but they are saying because it spreads through coughing and sneezing and droplets that come out of your mouth or nose, that can get on a dog's fur. And then if somebody else then hugs that dog or kisses that dog, it's possible for that person to become infected. Somebody else, I think it was BJ. Yeah, BJ mentioned that Therapy Dogs International has asked to suspend visits because of the same thing, that multiple people touch and pet those therapy dogs. So if someone's sick, theoretically that dog could be spreading it around.
So, one idea on that, Robin, is if you did have pet safe disinfecting wipes like the Virox, you may want to add a protocol that every dog gets their fur wiped down. And you could go out to your clients that, and you might want to do that in the lobby so they can actually see it being done. But you want to make sure your wipes are pet safe.
And that's exactly one of the protocols we would look at doing. Get some of those wipes that you can use on the dogs and use that as an extra cleaning protocol for now, so that you can help to alleviate some of the concerns of your clients. The other thing is, and Susan and I are obviously big proponents of off-leash play, but this might be a time when we don't offer off-leash play. So those clients that are really worried about it and don't want their dog interacting with another dog, maybe you just offer them some kind of a daytime boarding where they get individual care or one-on-one attention, but they're not put in play groups. So think about something like that to add to your model as well, because that might be something that would alleviate the concerns of people who are canceling because they don't want their dog interacting with other animals just because of the spread of the virus potentially. So you want to look at that too. So Janika said, I just had my dog tested for coronavirus. Should I ask my clients to get their dogs tested? That, my understanding is that is a different type of coronavirus. It's not actually the COVID-19. So I would not ask your pet parents to do that, because it's not, and the CDC website and the World Health Organization have more information on that, but it is a totally different strain that dogs get versus this one that the people are getting right now. So BJ asked, where can you get Virox? Virox is actually the brand name. So if you should be able to search for Virox. And somebody else asked, will diluted bleach kill?
Yeah, accelerated hydrogen peroxide product, also sometimes called Rescue.
Oh yeah, Virox is well known by that brand name of Rescue. So you could probably search for that as well. This is an interesting thing about, will anything kill COVID? Well, coronavirus, it's just easier for me to say. And when we talk to the folks at Virox, they basically can give you an estimation that they think it will, but to actually make that claim for anything requires FDA testing, which requires 12 to 18 months before FDA will usually allow you to make that claim. So the answer to that is, there's a lot of cleaning agents out there and they're probably going to kill a lot of things, but I don't think anybody right now can 100% claim that it would kill this virus, because they would need FDA backing for that. But they can tell you, they're pretty certain it's going to kill XYZ. And if it's similar to this, then it'll kill it. So that's kind of an interesting question though. All right. Where were we?
I think that's a good question kind of on our cleaning protocols and stuff of storing, handling leashes and dog luggage. I think adding a protocol that everything gets wiped down when it comes in and wiped down again between handling and then before it goes out is going to be the safe protocols.
Yeah, and then making sure that all of this is told to your clients ahead of time. And we're going to talk about communicating with your clients in a minute. I think in terms of those canceled reservations, we also want to look at kind of what other things you can offer to your clients. So I'll throw that back to you, Susan, if you want to talk a little bit about that.
Yeah, this is a time where you're going to need to kind of get creative, and day activities, camp activities would be great. But if clients, are concerned about that as well, hopefully this will be short term, to where once people, we know people get cabin fever, and once this kind of passes, what you may need to do is just know right now it's going to be low, but be prepared as soon as things calm down to maybe add some extra parties, events, camp activities, because dogs are going to be getting tired of being at home and not interacting with their other dogs. And so what you want to be prepared is to catch up as soon as possible. I mean, if you can, if people are canceling lodging, you might try and see if people would come in or bring dogs in for some extra activities. Maybe consider pickup and delivery or some concierge services so there's less contact. But it is a time to try to get creative and, you know, to know your numbers. You know, what's the impact of a 10% loss versus a 20% versus 50% loss. And I think the key is, again, as we talked about with your staffing, is knowing your numbers and at what point and how much shortfall you're going to want to try to plan to make up, because this will pass. That's what everybody is saying. We just don't know when.
Yeah, and I think it's going to just be important to play around with your numbers now and say, what does it look like if I have 10% loss, 15%, 50%? And hopefully you won't have that big of a loss, but you might. And then think about other alternatives that you can that can help you to generate revenue. So we talked about one is that possibly for some of your clients, guaranteeing to them that their dog won't interact with other dogs, that might be enough to alleviate them. Susan, when we were talking the other day, mentioned possibly going and picking dogs up. Maybe the owner doesn't want to go out and she doesn't want to be exposed, but you know, your client, I mean, your staff could go pick the dog up. That might be an option. So looking at that, but I would also be looking at, if for those dogs that do come and are willing to come, what can you possibly upsell to them? Like, this is an opportunity to do more parties with those dogs that are in your care for an additional fee. Possibly even doing some educational stuff virtually, or doing things where you can help your clients play and interact with their dogs at home, and you teach them that through the internet. So offering to teach a, you know, quick, hey, this is what we do when your dog's in enrichment daycare. We're going to, you know, sign up to join us, and it costs X amount. And then you just do that on a private Facebook group through Facebook Live like this, which would cost you nothing, you know, or if you have other software, you could do it, or you could videotape it and send them the videos for a fee, but something where you're getting them to interact with their dogs because now they can't come to daycare, but you're helping to facilitate that through some kind of a paid service online. We were brainstorming some stuff yesterday with our team, and we talked about maybe renting out some of your equipment. So if your equipment's all sitting in the corner because you don't have dogs, maybe you could take some of those climbs and rent them to your clients so that they could take them home and play with them and generate revenue that way. So get your team together and find some creative ways to try to recoup some of that lost income and revenue that you're losing if people cancel their reservations. Somebody just had a question. Oh, Sarah Richardson said, just to be clear, rescue wipes are safe to use on dogs. I do not think rescue wipes are safe to use on dogs. There was another wipe that Susan mentioned. Rescue wipes are actually designed for surfaces, not for the dogs, but they are really good at cleaning surfaces. And then there was another, do you remember the name of the one you just mentioned? There is a wipe that is safe for dogs.
Yeah, I would reach out. I wouldn't be surprised. I don't know about the rescue wipes, and I would look at the wipes that are safe on dogs to see if they will be effective. I think that's something we need to do some research on yourself and talk to these companies.
And there are wipes that are specifically designed for dogs. I used to have them in my RV, and I can't remember the brand name, that they're designed to do.
Earth Animal has a wipe. I don't know the ingredients to be sure that they would be effective against potential virus. So again, all this is new. We're just saying the caveat, don't go getting your Clorox wipes and putting down dogs. You got to make sure it is from the manufacturer has said it's safe to be used on pet coats.
Right. So this is great from Dee Dee. Said, I completed the first 2 years of vet school, and when going to farms for herd health, we would make a dip that everyone had to step in before they entered, and when they left the farm, we will be making 4 ounce per gallon solution of rescue as a dip for leash handling. So another idea for those leashes is to make that kind of dip and then put there, look, I just touched my eye. As a side note, make that dip for the leashes and then hang them up to dry. So that's a great idea, Dee Dee. I love that. All right. So going on to kind of dealing with your staff, you really, going back to those numbers that Susan talked about, kind of knowing what it looks like if you have a 10 or 15 or 50%, whatever your numbers are, just choose some numbers and start to calculate that. What does it look like? You also want to have that to understand how many staff do you actually need to manage however many number of dogs you have. So this is an opportunity to really understand what would it take for you to have to lay off staff. I mean, how much of a drop would you need before you started laying off staff? And then you get into the question of, if you're going to lay off staff, are you going to pay them? Because this is sort of no fault of their own. And you might pay them, you might not. I'm just suggesting that you have that conversation with your key leaders. And if you have a management team, with your management team, have that discussion now before you're in a panic mode. Because again, once you get in any kind of crisis mode, it's a lot harder to make these decisions. So think about all that now. If you are going to pay them, what does that pay look like? Are you paying them normal rate? Are you giving them some kind of a lower rate just to give them something while you have to lay them off? But talk about that. And then obviously you're going to need to come up with whatever your policy is going to be, and then talk to your team about that. And I would just suggest that all of the thought about that starts happening now before you reach a critical point.
Yeah. And, it is a time to get together and talk to everybody. Some of us were in our facilities back in the mid 2000s when we went through the recession. And, I did have conversations with staff. Could you take fewer hours? If so, how many? We're trying not to lay off, but we are going to have to reduce hours. And as a team, people would say, yeah, I can take this. I can still get by if I have 15 hours a week, whereas somebody else may need 35. And you may want to have those one-on-one conversations. At least they know that you care, but they also have to understand the business. I can tell you, my significant other is at oil and gas, and he unfortunately let his heart rule his business head when that industry took a downturn about 5 years ago, and unfortunately kept staff in hindsight longer than he should have. And this is all very hard. None of us want to lay off staff. However, as Robin said, you need to know what the realistic situation is for your business and make business decisions here and not just heart, because I've seen the aftermath and there's a lot of regret from that. So know what you can afford, and talk to your team about maybe reduced hours before you get to the layoff situation, and then tell them everything you're trying to do. That's where they can help as far as the dogs that are coming in. Robin said, helping do some of the upsells and brainstorming ideas for more revenue. And then just make sure that the staff are busy when they're there. This can be a time you can use people to help you get caught up maybe on some of the standardized procedures, doing some refresher training. It can be maybe a time for a while where you can still keep things going and making sure that these process sheets are done for everybody. So we're working smarter and not harder when we are there.
Yeah. So if you don't have your SOPs done, this is a great time to do them while you're slower. That's our motto. Sonia brought up a great point. Employees, if you do lay off employees, they may be eligible for unemployment compensation, depending on their hours and your state laws. So you do want to check into that as well. So that's a great point, Sonia. All right, then talking about communicating with your clients, I would start right now, today, if you haven't already done it, is start telling your clients what you do, how you clean, what systems you're using, because we're all cleaning, right? Like everybody's already cleaning. It's not, we're going to add some protocols maybe because of this virus, but your clients need to know what you're already doing and to be a little bit more confident that their dog is going to be safe if they do bring their dog. And I use the example, I received an email the other day from United, because I fly United 99% of the time. And it was a whole email about their air system. And they did not change their air system because of the coronavirus. But this is the first I actually knew what their air system did. Like I had no idea how that whole thing worked. And that's what we would suggest that you do now. Start telling your clients how you clean, any additional protocols you're adding, show them, do some Facebook pictures or social media videos. If you have pet therapy, a system or any kind of system where you're moving the air, make sure they know about that. If you're using clean bowls, and that's a great way to keep sanitation just in terms of feeding and eat the food and water for the dogs, make sure they know that. if you've added any kind of cleaning protocols, like some of the ones we talked about, dipping the leashes, make sure they know that. Just talk about the cleaning agents you use and how safe they are for the dogs as well as for killing viruses. And really, you're just trying to alleviate the client's fear. So these might be things that you wouldn't necessarily put on social media, but this is a good time to start highlighting those things and just really making sure that you're helping your clients to feel safe. If you're asking them to come in and use the sanitation when they walk in the door, make sure you're telling them that. So all of those things are really just going to help your clients to feel more safe about bringing their dog in. The other thing in terms of communicating with clients is you need to figure out, what does your refund policy look like? Maybe you're always willing to refund and then you don't have to change anything. But if you've got a policy that says they have to cancel within a certain amount of time, you might have to rethink that or look at that. And if you're changing any of those policies, making sure your clients understand that. For some, it might just be you're changing that policy just for a few months. So, but make sure your clients understand if you're going to charge them or let them out of any obligations that they made. So that's some other things you want to start thinking about in terms of communicating with your clients.
And then, being really clear about what you do expect from the clients. I mean, kind of like your staff, that if they're sick, possibly keeping the dog at home with them, or if they're on a quarantine, maybe working out a protocol to clean and you go pick up, if that can be an extra service that would bring in revenue. And then, what is the protocol on those handoffs? It's just figuring all those things out and how you can keep it safe for your team and your clients. But be clear about what your expectations are for them. Maybe there's a valet service that, again, they can hand you the leash, you wipe it off, and they don't even have to come into the building. So I think putting together a list of FAQs, there's been a lot of great tips shared here with our community, which we love that. Kind of brainstorm and think what things your clients might ask, and just run an FAQ list, that you can put out on Facebook. You can send it via email. You can have it as a handout, put it on your website. This is a time to be transparent and honest about all these things we talked about. Is their dog safe? What are you doing to keep them safe, the people and the dogs that come in? As Robin mentioned, being clear about the refund policy, and also putting out some of these facts about exposure to other dogs, the fact that coronavirus in dogs is different than the COVID-19. Anything you can do related to dogs, putting out facts. And also, I love the idea of, if people are home and their dogs aren't interacting, use some of your team to, put out videos and ideas on how to keep them from getting bored. Even if they're not coming to your facility and not paying, you're going to establish that relationship and that loyalty, that they're going to come back to you because you helped them when things were tough, and they can see that you're there to support that relationship with them and their pet.
I'm going to go through a few questions. So, wait, somebody had a question. I'm looking for it now. It was about grooming. Wait. There's so many questions in here.
I think what they were asking.
Here we go. I found it. Yeah. So Jenny said, we offer grooming. Would you recommend bathers protect with masks and gloves? I would not. And the main reason for that is if they're going to wash the dog, they're going to wash off anything. I mean, you might want to do a wipe of the dog if you're worried that it has droplets on it. And just the whole discussion of dogs is the dog itself cannot give it to you. So it doesn't spread dog to person. The only way a dog could you could catch potentially something from the dog would be if the dog was around someone who was infected and that person coughed on the dog, and then you then hug or kissed or whatever that dog, and those droplets got picked up by you. And so it's really less likely to happen that way. But so for your groomers or bathers, it goes back to what Susan just said. If you have a dog that's owned by someone who has infection, maybe that dog doesn't come to your facility, or maybe you're doing a really good wipe down before that dog starts playing with, your staff or other dogs or whatever. But I think for the groomers, they've really said that the masks don't do a lot anyway. And it helps you if you're coughing, so you don't cough, but it doesn't really help other than that. And the bigger issue is really the healthcare community actually needs those masks to do their jobs. And they're finding, my daughter actually works in a hospital. She said all of their masks were stolen, like literally stolen from the emergency room. And that's a critical problem for the healthcare workers who actually need them, not just for coronavirus, but for lots of other things. So I would not recommend that, for multiple of reasons. So I think that is not necessary. And then Samantha had said on petedge.com, they are advertising that their kennel cleaning solution kills coronavirus. So just to be clear, and you can find all this on the CDC website, because that's where I found all of it. There are multiple human coronavirus types. So this one we're talking about, this particular outbreak, is COVID-19 is its identifier. Coronavirus has been around for a long time, though. That's basically like a brand name, so to speak, for it based on what the actual virus looks like. So coronaviruses are crown-like spikes on their surface, whatever that means. But that's what CDC says. And there's actually 7 different types that can affect humans. And then there's other types that can affect dogs. So if you go and get your Lysol can, because I did this the other day, it says Lysol kills coronavirus too. On my Lysol can, it said that. But it may or may not be COVID-19 because that's a brand new virus. So if that makes sense. So it can be a little bit confusing. So you have to just know what specific thing they're talking about when they say that. And then Jess Ocon had said, now's a great time to sanitize the things we don't typically clean regularly. And that is definitely true. So again, it goes back to that, what you might clean maybe once a week or once a day, maybe now you're cleaning multiple times a day. And that includes really any place you might get germs because someone sneezes when they walk in or cough. So definitely looking at all of that. So I think, let me just scroll through. I think we kind of covered the majority of topics just as a high level overview. We want to continue to offer some of these. We're going to have some more Facebook Lives coming up in the next few days and weeks as this continues to impact our industry. And if you're looking for ideas, definitely email us and, we'll be happy to help facilitate creating things that our industry might need. I know somebody earlier said, do we have any sample letters? And that's the stuff that the Dog Gurus really want to help you all with. So if you have ideas or your facility is going to need it and so are hundreds of other facilities, we can help to maybe get some of those prepared and send them out to everybody just to help facilitate some of the stuff that we're all going through. If you have questions, we're happy to try to do some of the research for you. And then we are going to be putting together kind of a list of resources for pet care facilities. So if you're not on our email list, just PM us with your email and I will be happy to add you. If you can put it in the comments and I'll scroll through there. But if you don't want to list your email to everybody who reads these, you can also just private message the Facebook page and then we'll go in there and we'll add you to our email list. Or you can also just email either me or Susan at robin@thedoggurus.com or susan@thedoggurus.com. So, but we appreciate everybody joining us. Do you have any last things, Susan?
No, I think this is a great community to share and get ideas across with each other, and definitely we have a Facebook group as well as the page, but Grow Your Business Facebook group. We can definitely continue these discussions. I think what will be helpful is right now is the communication to clients, your team, and getting those cleaning protocols in place. But I think the next thing we're going to want to focus on is definitely that revenue generation. So as Robin said, we're going to do more of these to try to be right there with you as we're all kind of blazing new trail, but you've got a community of resources here that we're happy to facilitate.
Yeah. All right. Thanks, everybody. Have a great rest of the day.